Hi, Cynthia. Thank you for joining me on the podcast today. How are you?
I'm doing well. Hi, Bettina. Thank you for having me. It's truly an honor to be here today. First of all, I just wanted to, acknowledge the incredible work that you're doing and the impact that you're making. So thank you for, having me here today. And I look forward to discussing my journey and, how innovation can drive better patient outcomes, all while keeping that human touch. So looking forward to our chat today. And so thank you.
Thank you so much. I always love starting this question because I have been talking a lot recently about unveiling the mask and getting grounded and getting into our true authentic selves. And you have such incredible titles, such incredible background. But I'm curious, when you strip all of that away, at the core, who are you?
At the core, who am I? Um, okay, so at the core, I'm a problem solver. I see myself as a problem solver. I am a problem solver, and I am an eternal learner. I'm constantly learning, and then also I am a connector. I'm a relentless advocate when it comes to making it, when it comes to progress, right? And in every space that I find myself, I am always figuring out ways to make things better. That's just who I am. I am a wife. I'm a mom of three adorable kids. I'm a daughter. I'm a sister. I'm a friend to many. I'm a mentor. And I'm a great listener, right? I'm someone who is deeply committed to making meaningful impact in people's lives. I love to laugh. I love to build relationships. I love to embrace new experiences. And, I believe in the power of knowledge. I believe in the power of networks and having those genuine connections, with people so that we're bringing people together.
That's so beautiful. And
Exactly.
I want to dive deeper into that if you're okay with me diving deeper.
Sure.
Um, you're a connector, you're a problem solver. And I think the women that we have on this podcast, they are doers and they love to serve others. And I'm curious for you, how do you fill your own cup? How do you put on the oxygen mask on first for yourself?
Well, my oxygen mask, I would say it comes from God, it comes from up above, right? I have a deep relationship with God, and who has been my guide, has made ways for me, even when the path seemed unclear, right? And when I get super overwhelmed, his presence in my life has shaped my resilience, my purpose, my pretty much everything. My unwavering belief in that every challenge is an opportunity for growth and impact. When I'm fully like exhausted, I try to find that quiet time, that space, quiet space, and just close my eyes and meditate, and then also just being around, having a great support system as well. Those are that's what really fills my cup for me when I am feeling very low or when I just need that recharge.
That's so beautiful. And it's been so interesting because we bring on so many high performing women and they talk about all of the amazing things that they've done, all the jobs they've done. Maybe they get into finance, they're unhappy, they go to the next job, they might go to consulting and they're like, I'm so unhappy, I'm going to start my own business. Or they go into something and they decide, maybe this thing will fulfill me. And then they realize, wait, it's not externally, it's not what another person or another company can do to make me happy. It has to come from me. And you seem so sure of yourself. What was the process like for you in finding your why, the reason why you do the work that you do today?
That's a very that would be a very long story to finding my why. Um, so as a young girl, I grew up in Nigeria, and I suffered malaria. I'm not sure if you know what malaria is, but it's
Yes.
the flu times 10. And it wasn't just a one-time illness, it was recurrent and relentless because of my blood type. And so uh and most times malaria would land me in the hospital for, many weeks at a time. And sometimes, sometimes it could be up to 2 weeks, 4 to 5 days. It all depended on what it was. And so I endured endless medications, painful injections, and, a disruption of, missing school. But I missed those difficult moments. Something sparked my curiosity about medications. How could these tiny pills, have such a profound effect on my body, right? And so that realization, even at a very young age, planted the seed for my journey into the world of pharmacy. And so when I moved to the United States, I pursued this passion at Temple University School of Pharmacy, and then, after that, I later began my career at a community as a community pharmacist. And it was fulfilling. I had that direct hand in ensuring that patients receive the right medications, they were counseled, right, and all of that good stuff. But it was also eye-opening for me. And then so from working in the community, I transitioned to different settings where pharmacists could work on the inpatient side, on the outpatient, at medication management, long-term care facilities. And as I transitioned from one clinical setting to the other, right, I saw firsthand the widespread medication-related problems that patients faced. And that was when I quickly realized that a lack of a proper medication management was leading to preventable medication-related problems, preventable hospitalization, unnecessary deaths, right? And so, many patient stories that I can tell, but one of patient story that um, I could tell right now is a patient who was always in and out of the ER for asthma attacks and respiratory related problems. And so, and she was labeled a frequent flyer, but no one really knew why she wasn't improving, right? And so when I spent time, my team and I spent time with that patient, and we conducted a thorough medication history. We found out that her daughter was actually administering her inhaler through the nose and not through her mouth, right? And it was unintentional, and that reduced the patient's medication's, effectiveness. And so, just a simple misunderstanding of how to use a life-saving medication had caused repeated hospitalizations. But the tipping point for me in my journey was about 7 years ago, when an elderly woman bled to death due to an unintentional medication overdose. This tragic incident was 100% preventable had there been a proper medication management solution for that patient. And so that was the moment that totally changed everything for me. It wasn't just about, dispensing medications anymore. It was about preventing avoidable harm and doing that at scale, right? And so, as a board certified geriatric pharmacist, and given the experience that I've had in different settings, that was what really pushed me over the edge to found PharmD Live, where we can address these types of problems, medication-related issues, at the intersection of technology and the clinical pharmacist expertise.
That's fascinating to me. I mean, so I am a firm believer in taking medication that your doctor, prescribed you for. I've been on epilepsy medication since I was 14, and I'm a firm believer it has saved my life. And I've also been on the other side of it. After I was raped, I'm very open about this. I was raped and changed my life. I could barely get out of bed in the morning. And a really long healing journey. And I found my personal experience with antidepressants didn't work for me. And I went on a whole healing journey holistically, changed my diet, went to a soul coach, got a therapist. I do all the things that I practice in Fortify Wellness, which is now HIPAA compliant, 360 approach to wellness, therapy, coaching, fitness, and meditation on one subscription platform. So I come from a really interesting place where, on the one hand, I felt like the doctors didn't ask enough questions about what I was going through and didn't prescribe me the right thing, the right dosage. And then I live in another world where my epilepsy medication, I believe, saved my life. So I live in these two worlds, right? And I had a really interesting experience a month ago. I saw a holistic doctor. He spent 2 hours with me, which I've never had that experience before, where he asked about mind, body, soul, what I went through psychologically in my past,
Mhm.
how much I'm working out, all those things that I feel should be taken into account in prescribing any types of medication. So I'm curious what the balance is from your perspective in, you know, wellness, holistic wellness, mind, body, soul, diet, fitness, moving your body, and prescriptions. What is the balance? How do we find it?
Yeah, so I like to, when you talk about balance, I like to even start from one size does not fit all, right? With medications and with fitness, wellness, one size doesn't fit all and never will. So looking at things from the medication, management standpoint, what we are doing at our organization is ensuring that the patient's medication regimen is tailored to that particular patient. And we do, we leverage pharmacogenomics, and that's where medications are tailored based on the patient's genetic makeup, right? And so I believe in personalization when it comes to medications, and then also when you're looking at wellness, it's looking at the patient as a whole, right? And it's not just go to the gym, go do this and do all of that. It's all about is a partnership with the patient, partner with the patient, and and really coming up with a plan, a solution, right, that would work with that would work with the patient, because at the end of the day you want to empower the patients with the right tools, the right resources, the right knowledge and information for them to live their best life, and to empower them for disease self-management and medication self-management on their own. And that comes through a whole lot of motivational, counseling, education. And it's not a one-time thing. It's continuous, because as humans, we're continually evolving in our thoughts and our knowledge, right? And new information, it's coming out every day. And so it's very important for us to constantly partner with our patients and have that engagement on an ongoing basis, so that we're looking at solutions, and really figuring out what's going to work best for a patient, and then also giving the patient a seat at the table in coming up with the best plan, because the best plan is the plan that the patient would actually execute, right? And so you can prescribe the best medications to the patient, but if they really don't have the why, they don't understand why they should take it, and sometimes they may understand why they should take it, but then just knowing the benefits of the medications and how to manage those meds and how to incorporate all of that into their whole wellness journey, that's the approach that I would like to take, is that equal partnership with the patient in coming up with a wellness plan for them.
I'd love to highlight the genetic makeup. How does, and I know that's a big question, but how does our genetic makeup sort of like predispose us to certain, maybe it's certain mental health issues, maybe it's physical issues? How does that take an effect in prescribing medications?
Yes. So, we're all different physiologically. And then also, when you look at how we process medications and how our body metabolizes medications, it is different, right? Some of us are fast metabolizers and others are slow metabolizers. And so if I administer a medication to a patient who is a fast metabolizer, right, there may be a need for the dose to be slightly higher because of that, genetic makeup of that patient, right? And then for those patients who are slow metabolizers, there may be a need to reduce the dose, right, so that we can get the patients to the right spot where they need to be, and the right drug levels for these patients. So that's what's really we consider when we look at pharmacogenomics, how the patient's how our bodies are reacting to the medications and what the medications is doing to our bodies. Two different things, right? And so it has to be a balance of both. And especially in when it comes to behavioral health, and sometimes we find that medicate I could even say some of the antidepressants as well. Patients may have been on this medication for for a while, and they're not really getting any benefits from those medications. And not that the meds are not really effective, it's just that we really haven't titrated the dose to where it needs to be for the patients to have that effective outcome from that medication. So pharmacogenomics, it's very important. It's new. It's evolving, and I'm very excited, about the prospects of pharmacogenomics and how it's going to help with personalized medicine.
That's beautiful. And when we're talking about personalization, that's assuming that the client really feels comfortable being honest about their genetic makeup, whether that's their mother had breast cancer, father has alcohol addiction that could make them genetically predisposed to something else. What do you say to the person that's like going into their doctor and they're kind of intimidated to be kind of honest? Maybe it's about themselves personally. Maybe it's like they might drink too much, or they might have some insecurities about their mental health. What do you say to that person? Because a huge part of it is, in order for them to get that holistic care, they have to be honest. So to the person that's like, I'm a little intimidated, what's your advice to that person going into the doctors?
Well, I would say that your doctor wants the best outcome for you, right? Your doctor is there to be a partner to getting you to your best health possible, right? And why should you go to that physician, right? I wouldn't go to a doctor that I don't trust, right? And so in selecting our physicians, it's very important to do a due diligence, proper research to identify a physician who we can trust. Now, when we have that physician who we can trust, we really need to put everything on the table, because your doctor needs to have the full picture, right, in order to make the best informed clinical decision. That it's a test that the patient has to go through, whereby a sample is collected and that's been analyzed, sent to a lab and it's analyzed, and then based on what the test reveals, right, we can then tailor the patient's care based on their genetic makeup. And so and we're going to see more and more drugs have pharmacogenomics information. I believe about more than 400 medications now have, when you look at the FDA package inserts, they have the genetic with the patient's genetic information before we even prescribe it, right? Because it's really, really important. There's something, there's, the drug gene interactions. It's a real thing. And medication Plavix, it's when you look at the patient's genetic makeup, not all patients should be on Plavix. It wouldn't be effective in patients who, let's say, are would not do well on that medication. And so pharmacogenomics has helped us identify those patients who are not good candidates for that particular medication Plavix, that is used to prevent a clot from forming.
Very interesting. And I would love to kind of transition a little bit to talk about PharmD. I'd love to hear more about your journey and how, your career path led you to this intersection of healthcare and technology.
Yeah, and in terms of, I don't even know where to start with. In terms of my experiences and my journey, it all had to do with, because I've been exposed, to the different verticals in healthcare, right? And being in different settings, inpatient, outpatient, long-term care, community pharmacies, different settings, right? I was and seeing things through the lens of a geriatric pharmacist, the one common denominator that I saw everywhere was medication related problems that no one was really paying attention to, falling through the cracks, causing problems in patients. And that's partly due to the disjointed and fragmented healthcare system that we do have, right? There's no one person who is overseeing the patient's entire medication profile. No one person. Our community pharmacies, the likes of the chain drugstores, we have pharmacists there, and well-meaning pharmacists. But then again, the work environment really puts a constraint on the time that they're spending with their patients. Now, when you go to the physician, we're spending about 5-10 minutes with our doctors, right? And that's just because of the way the healthcare system has been designed. Physicians mean well, they want the best care for their patients. But then again, the time constraints really limits the physician from spending more time with the patients to really uncover more information, more clinical intelligence, right? And so I seen where the gaps were, and then also what the technology can do, right? That was what really led to starting this type of organization and then designing a solution like we have put in place, so that we're analyzing the patient's data from multiple sources and superimposing that onto what the physician has in their EHR, and then looking at all that, looking at the patients through different lenses and having that 360-degree approach to patient care and supporting clinicians that way. So supporting all doctors' offices, with this actionable clinical intelligence that we can bring to the table, and that also enables the physician to make the informed decision for their patients.
Interesting. So I'm assuming that is how the AI comes into play in helping the physician get that 360 view of the client, correct? Is that kind of what I'm getting?
Exactly. So part of our solution is that interactive engagement. So we engage with the patients on a monthly basis, right? And this is all in between their doctor visits. Some of the patients see their physicians, let's say once a year, sometimes. The higher risk, high complexity patients may see their physicians 3 times a year, but a whole lot happens in between those doctor visits. For example, so during our patient engagement, so that's why we engage our patients on a monthly basis. So during our patient engagements, we often come across patients who are, what they're doing at home with their medications is totally different from what the physician has in their electronic health record, right? So we have patients who are like splitting their pills. We have patients who are who purchase medications out of pockets. Let's say that when they go to Canada or when they go to Mexico or whatever they travel to, right? They're buying medications, directly from the pharmacy, and the physicians have no knowledge of these other additional therapies. And then you have patients who are seeing different prescribers, different specialists, and when you look in the EHR and look at their medication profile, there's just a whole lot of discrepancies between what the physician actually has in the EHR and what the patient actually does at home. So part of what we do is during that engagement, we then pull and collate all of the patient's medications from different sources and put it all together, right? And so with our technology, right, it actually enhances. It doesn't replace the physician, it doesn't replace the pharmacist, but rather it enhances what we do, right? And enhances that human element within healthcare. So at PharmD Live, we use our AI driven technology to analyze risk factors, not just risk factors from medication, but also risk factors from social determinants of health as well. Of course, we're looking at medication-related problems and optimizing the patient's care plans. And but that's always paired with the pharmacist oversight and that personalized patient engagement, right? So for example, our technology can flag that a patient is at high risk for adverse drug events, but it's a clinical pharmacist who then steps in to have the real conversation have that engagement with the patient, work with the physicians to adjust the patient's therapy, and and then also provide that compassionate care to our patients. So our technology accelerates the insights, but that human to human connection between our pharmacist and the patients is what drives better outcomes and eventually supports the physicians to deliver the highest quality of care to their patients.
I think that's great. I mean, there is such a gap. I had on the co-founder of PharmD, and they'd spend between about up to 45 minutes with their patients, with women. And it's a beautiful thing because I think a lot of times in healthcare, women are gaslit into thinking like what they're feeling is not accurate. And in a lot of ways, we have to advocate for ourselves. I've had to advocate for myself. I know a lot of our listeners have had to advocate for themselves in the medical field. And they offer a really interesting gap because they spend a lot of time with you. They look at the client, the patient holistically. I'm a big component of that. And then it was interesting because recently I went to India and I got food poisoning and I went to the
Oh,
doctor
no.
and I got an IV and it was 37 US dollars for the IV and for the medication. And I'm thinking these doctors were great. I had a great experience. And something like that in the US, it would have cost like over 300 bucks. So you think about like this gap here. And, I think about my mother. My mother is in a wheelchair. My mom has a lot of, physical ailments. And she was doing a treatment for her rheumatoid arthritis. And then a doctor suggested a different treatment that ended up being $1,000 a month. It would have been $1,000 a month. And she wasn't sure if insurance would cover it. And so what I notice, and what I'm noticing by talking to a lot of people in the medical world, is that there's also this gap in, does your insurance cover this prescription? Is this accessible? There's also that gap there because what I'm learning is that it is attainable to have affordable healthcare. And, as you're talking about holistic healthcare and helping meeting those gaps, it's so important because I understand that clinicians are very burnt out. They can't spend all this time with patients. On the other hand, patients need better care, more in-depth care.
Exactly. Mm-hmm.
It's in the same way with therapists, in the digital wellness space with therapy, patients are feeling on other platforms that the therapist isn't spending enough time, doesn't care. And maybe it's true, maybe it's not true. Either way, we have to meet that demand somehow. And I think it's really interesting what you're doing. You're kind of bridging this gap here and allowing more attention to come to the client, because again, things might change, circumstances might change, whether it's in their diet, whether it's in an environment, that might shift the way that their body is reacting, their mind, body, soul is reacting to the medication. I'm curious, is your company, does it take insurance?
Yes. So what we do, chronic care, we have lots of product lines, and most are covered by insurance, especially Medicare covers what we do because it's preventative and it helps reduce cost and improves the patient's outcomes, right? Also, some of the commercial plans accept we accept some of the commercial plans, because they do cover what we do. There's a whole lot of value in medication management, and then we also do have some patients who can pay out of pocket. We have patients who reach out to us, say, hey, my mom is on about 20 medications and they really can't manage, the medications are overwhelming to the caregivers, to the patients themselves. So we see all sorts of patients, and they could be paying cash or through their insurance.
Amazing. Yeah, I mean, I think it's definitely needed. And I'm curious, the AI component, is a client going to use the service that you have, talking to a person? Is it through an AI service? How does it work?
Yeah, so if we have a patient who is part of our program, our pharmacists leverage our technology to provide service to them. So the patients really don't have to do anything, and that is tech driven per se. Most of our patients are elderly, and they're technology averse, a vast majority of them. So our team members leverage our technology to provide care to the patient. So the patients really don't need to have be tech savvy or any of that. And even when we partner with clinics, our goal is always to provide a turnkey service, a turnkey solution end to end, right? Our goal is to reduce the work load, reduce the work burden, and decrease burnout for our partners. And so our team, we handle, we do the heavy lift, and we do like 99.9% of the work, because we know that our partners, our clinic partners, they're already busy, and with patient care, day-to-day patient care in their offices. And so we assume the entire workload of all things medication management for their patients.
Mm, very exciting. You definitely fill a gap for a lot of people. And I want to go back to you. We hopped around a lot, but clearly you care about people. Clearly you're meeting so many gaps. Clearly you have such an incredible background. I'm going to kind of wrap this thing into a bow here, because it's really interesting. There's like such a pattern with everyone that I have on here that I always like to highlight, is that we love to serve others, and then it's like we forget to put the oxygen mask on ourselves. And so I want to dig deeper, because I know you had said your mother, your daughter, all the things. And even when we strip those things away, it's incredible what you're achieving, what you're going to achieve in the future. And even beyond work, if you were to give your personal mission statement of your why and why you do what you do, I'm going to put you on the spot a little bit. What would it be?
Why I do what I do. Why I
Why
do
you're
what I do.
this planet, just being Cynthia, taking even work out of the picture.
I just want to leave the world better than I found it. You know,
Mm,
I believe that I believe that I was made for a purpose. I believe that God has given me an assignment to make a difference in the lives
mm,
of others. And that's what makes me, that's what I wake up every day excited to do, is to leave that, lasting legacy, and having that positive impact in our world, just improving the lives of others. That's my why. Wherever I find myself, I'm always looking at, trying to identify how can things be better, right? How can I leave this better than I found it? And that's the value. What I say that I instill in my kids. I try to instill in them, to always leave things better than you found them, leave people better than you found them, and just, um, whenever you encounter anybody, let that person feel better that they just encountered you.
mm. I agree. I 100% agree. And I think you've overcome adversity. So have I. And the reason I put out this podcast is because there's someone there listening going like, it's not going to get better. And like, it will get better. And I think in a lot of ways, when we're talking about overcoming adversity, or why, the things that we do, everything with social media can feel overwhelming to people, because they're like, oh, I can't achieve that, or I'm not doing that. And when you take all of that away and all the fancy titles and everything, we're all going through the same experience, which is like, how do we love ourselves harder? How do we make the world better than when we left it? We all have adversities that we've overcome. And I really do believe that if we can think about and take away everything that we're doing, and we just isolate into what's our personal mission statements, and accept the emotions that are coming in, tagging the emotions. I had that experience yesterday. I was feeling really stressed out, and I had all these meetings, and I'm like, you know what? I'm going to go hop on my Peloton. Like, I needed to do that for myself. And I'm noticing that when you reward yourself, that's the real self-care, that's the real self-love. And that is what is so cool about these people I have on, like yourself. You show up for yourself. And that's really how you're so strong. It doesn't just come up out of the air. Like you didn't go from going through and having malaria to, yes, I'm going to go and be a pharmacist. Like there was something coming in between, right? That made you go, you know, I have to fight for myself back. So that's so cool to me. And you're a superwoman. So I wanted to highlight because I think we skip over that. Like we're like, and I do too. Like I go, yeah, I went through this thing and now I have like no, there were some steps. I had at one point in time had to lift myself out of bed, then stand up out of the bed, walk to the bathroom, brush my teeth. Like there were things in between. So I just love the work that you're doing. And I just think that you're offering such a service to the world. We need it. And do you have anything exciting coming up with what you're doing with your business farm and PharmD Live that you'd like to share with the audience?
In terms of exciting, what's coming up, there's a whole lot. There's a whole lot of exciting projects in the pipeline that we're working on, right? But I would say when I think about the future of PharmD Live, I envision, a future where every doctor's office has a virtual clinical pharmacist supporting them, supporting that team, right? And seamlessly um, integrating medication optimization into chronic disease management. That's, what we're working on, and we're doing that one clinic at a time. And so we do have other projects that are coming up that we're working on, and then scaling our technology enabled model, ensuring that medication safety and adherence is they're not just afterthoughts but the standard in patient care, right? And so, also scaling our technology. It's because we're working on upgrades at this time, and so having that AI driven clinical insights and leveraging pharmacogenomics, because pharmacogenomics is still in its infancy, right? And so, merging those two and just exploring all the possibilities out there. That's what's exciting to me. And just having the pharmacist, as a partner, as a support system for the clinics. It's, that's what we're working on, and just working on being the catalyst for that change, and and being able to bring this mission, continue on this mission through the projects that we do have coming up, and the exciting you know uh, solutions that we're bringing to the market.
I agree. I mean, it's our duty, I think, for people in healthcare to really step up for clients, for patients, and give them the healthcare that they deserve to live sustainable lives. I believe in that. And to close us, what is your advice in like a couple of sentences for an aspiring healthcare leader and entrepreneur who wants to make a meaningful impact in healthcare? It's a big question, but why not?
Well, in terms of my advice is, first of all, there are going to be challenges. Um, just entrepreneurship is, I think it's about 90% adversity, if you ask me. But I would say through it all, you have to be relentless. You have to be relentless, and just focus on whatever. You have to restrain yourself from, not jumping into everything, because there's so many shiny objects. And when you do that, you would lose focus. And one day you'd wake up and not even recognize yourself or recognize the journey that you're on. So you have to fearlessly and fiercely stay focused on that vision. You have to lead with what we and impact driven solutions. You have to surround yourself. I can't even say this enough. You have to surround yourself with the right people, so that you build a strong team. Seek out mentors. It's very, you have to seek out who been in your shoes and understand where it hurts and who can hold your hand. And I would say, don't wait for the perfect time. Initially, when I started my journey many years ago, I would wait for everything to be perfect. Perfect timing. It needs to be perfect. No, no, no. If you see a gap, whatever needs to be done, you have to take action. You have to test it. You have to fail. You have to iterate and keep refining your approach, right? But above all, I would say stay resilient. This journey is not for the faint of heart. And yeah, just be resilient and be relentless and focus on your vision and mission.
I think that's great. I agree. And to add on that, I would say mind, body, soul, do the work. Serve yourself, oxygen mask on first. Because
Exactly.
there's no award for, biggest, most burnt out entrepreneur, CEO. There isn't.
No, no.
And it
Yeah.
will show up. It will show
Yes.
up, you know?
Yes. Health and wellness, your health and wellness is non-negotiable. When I first started, yes, I got into the mindset of, oh, the entrepreneur has to be burnt out. You have to, go 2 days without sleeping. You have to hustle hard. Yes, you have to hustle hard and work hard, but you should have your non-negotiables. My non-negotiable is my health, my wellness, my fitness. And so I carve out time every single day, rain or shine, to pour into myself with fitness, wellness, making the right choices. It's still, a work in progress, but it is a non-negotiable for me because it's been a while, and I've grown up on this journey, and I've realized that first of all, health is number one priority, and then comes everything else. Because if you're not healthy, then you really wouldn't be able to achieve, all that you're set out to accomplish.
Oh, yeah, I agree. And like the very baseline, it's just like you're worth it. Like even without when I realized like without the fancy company that I was still worth it, it changed everything for me. I performed higher. Like your worth isn't contingent on XYZ, that partnership, that VC raise, that whatever is worth it just because you matter. And that grit that you're talking about, that's real self-love. You going like, I'm gonna carve out an hour to go work out. That's self-love. That's a real self-love. So that's beautiful. Let's end on that. That's a powerful note. So this was a treat. Thank you for spending the time to chat with
Thank
me.
you.
Inspired by you.
Thank you so much for having me. Thank you. Thank you. I'm so grateful for this opportunity to share my journey. And I look forward to, continuing to make the impacts alongside other change makers such as yourself. So keep up the great work of what you're doing here. I love your work.